Experiencing green discharge during pregnancy can be alarming, especially when you're trying to ensure that everything you do is healthy for both you and your baby. It's not uncommon for pregnant women to have some form of vaginal discharge, but if it turns green, has a strong odor, or feels different from your usual discharge, it's a clear sign that something might be going on. While it can be unsettling, green discharge is usually caused by an infection, and in most cases, it's treatable. Let's explore what this might mean, what causes it, and what steps you should take to address it. Typically, vaginal discharge is a whitish or milky color, and it's completely normal during pregnancy. However, green discharge stands out because it often indicates an infection, particularly if it's thicker than usual and comes with an unpleasant smell. The most common cause of green discharge is an infection caused by a parasite called Trichomonas vaginalis, which is the cause of trichomoniasis, a sexually transmitted infection, STI. Alongside trichomoniasis, green discharge can also result from other STIs or infections, such as gonorrhea, chlamydia, and bacterial vaginosis. In addition, the presence of vaginal warts or foreign objects left in the vagina for a long time can cause similar symptoms. If you're pregnant, it's important to understand that green discharge is not a normal part of pregnancy. While some vaginal discharge is expected and considered normal, especially in the first trimester, it should never be green or have an unusual odor. Healthy pregnancy discharge, known as leukorrhea, is typically thin, milky, and mild in scent. Anything outside of this could be a sign that something isn't quite right. One of the key causes of green discharge is pelvic inflammatory disease, PID, which is often the result of untreated STIs like gonorrhea or chlamydia. PID can lead to long-term complications if not treated, affecting your reproductive health and even your ability to conceive in the future. Another culprit is bacterial vaginosis, an imbalance of bacteria in the vagina that can lead to foul-smelling green discharge. Chlamydia, a common STI, can also lead to green discharge, along with a strong odor. If you have had foreign objects, such as tampons, left inside for an extended period, it can also cause infection and result in green discharge. Green discharge can also raise concerns about your pregnancy's well-being. Gonorrhea, for instance, can lead to severe complications like miscarriage, premature birth, and low birth weight if left untreated. If the infection spreads, it can even affect the baby during delivery, causing infections like conjunctivitis or sepsis. In addition, green discharge could signal the presence of leaking amniotic fluid, which is something that requires immediate attention to ensure the health of both you and your baby. When you notice green discharge, it's essential to take action. The first thing you should do is consult with your gynecologist. They can run tests to determine the cause of the discharge and recommend the right treatment. If the discharge is due to a bacterial infection like trichomoniasis, it can usually be treated with antibiotics like metronidazole or tinidazole. These medications are safe to take during pregnancy when prescribed by a doctor. To manage the situation and stay comfortable while waiting for your doctor's advice, you can wear thin pads or panty liners to avoid any discomfort or embarrassment. However, avoid using tampons as they can irritate the area and potentially worsen the infection. Additionally, maintaining good hygiene during pregnancy is crucial. Make sure to clean your genital area gently and regularly, always wiping from front to back, and change your pads frequently to prevent bacteria buildup. It's also important to avoid douching, as this can disrupt the natural balance of bacteria in your vagina and increase the risk of infection. Wearing cotton underwear is a simple yet effective step in reducing the chances of infection, since cotton is breathable and helps absorb sweat. Lastly, take care when choosing soaps or body washes, opting for unscented, gentle products that won't cause irritation. If you experience any unusual symptoms such as pain, a foul odor, or increased discomfort with the discharge, it's time to consult your doctor. Additionally, if the green discharge is accompanied by a burning sensation during urination or pain during intercourse, these are signs that you need medical attention right away. While green discharge during pregnancy can be worrying, it's important to remember that it's treatable. The most crucial step is to consult your healthcare provider so they can determine the cause and prescribe the right treatment. By staying informed, maintaining good hygiene, and seeking medical care when necessary, you can manage green discharge and keep yourself and your baby safe and healthy.